Welcome to the Pain Podcast, Le Pub Scientifique. My name is Bart from Buchem, and I'm here with Tim Beams, my fellow colleague, physiotherapist and pain specialist physio. Great to have you again, guys. Today's subject is going to be an interesting one. As always, we're going to break the quick fix, and we're trying to understand why it's persistent pain treatment. Just give you a bit of context of what we think for this podcast subject is worth listening, because I think we just have to explore a bit what basically quick fix mentality means, why it's there, and why it persists perhaps, what the consequences are. We're going to talk about shifting that mindset, trying to see if we can educate patients and ourselves, obviously, to long-term pain management and effective treatments. And we even tap into what clinicians and patients can do to break this cycle. And perhaps we got some closing thoughts. Let's just get started. So, Timmy, quick fix. I do have a slightly, let's say, negative relationship with quick fix. It's from a, let's say, medical perspective, and I'm biased here. It sounds like a bad thing. I'm not sure if that's always the case, but let's dive into the subject. Quick fix. How would you define it, and what are we going to talk about it today?
Yeah, well, I think it sort of says exactly what it is, but then there are immediately problems. So quick fix it's saying that we can fix a pain problem and quickly as well. And and I think from a personal perspective, if I'm in pain, do I want it to go straight away? Absolutely. I totally, I am on board with that. I've experienced that myself as well. I had really horrible back pain and sciatica last year, and I had it for a few days, and I wanted it to go away. And in a way, that's the beauty of pain, is that it's so horrible. It forces you to really notice it, change what you're doing. And reach out for all the strategies that you've learned through your life, or that you've been exposed to on the TV, social media, from friends, family, to try and get rid of it. In other words, to fix it. So on one level, I'm absolutely with you. Working with people who have persistent pain, so they've experienced something over a long period of time, thinking that there will be this sort of magic bullet, if you want, this incredible unknown thing that you just take, and then suddenly, woof, everything is going to return back to normal. I think is potentially harmful, selling that as an idea for some people. But I can also see it from the other side, and it's problematic, isn't it? That we have this sort of dichotomy. There is one is what we see as being more possible, and one is what we want, and that the two don't necessarily marry up together. Yeah.
So I guess what you're saying here, and I would agree there. It's about the expectation of what another person or a thing can do for your problem, right? Without, and also I feel like there is maybe this negative assumption from my side would be it will be a passive treatment, particular. But could a quick fix also be a active?
It could
procedure?
be. It could be, yeah. And if you think about, like, the most obvious ones would be diet, wouldn't it, for weight loss, is that you could do something, you are in control of it. And an expectation might be, I'm expecting to weight to suddenly woof, drop off. And we obviously know about dieting and yo-yo dieting and people doing it. And the perhaps this is part of the conversation is it isn't something to be done in the short term. It's a shift in mindset. It's behavioral change at the heart of this. Is then seeing whatever it is that you're doing for wellness. Let's take the diet as the example. Whatever you're doing there in terms of your eating, it's a habit for life. and you
Yeah.
take it
So
back on
so
board.
so dietary could be a quick fix if it works.
It could be. Well,
And it's not really hard to do.
I guess the really quick fix would be someone, doing some sort of stomach surgery, stapling or something, and then, and then rapidly seeing weight drop off after that point.
Yeah. Also think about like and the quick fix could also be giving up paracetamol in what they call the medicated headaches, right? So the induced headaches by paracetamol, for example, just give it up, and you will probably won't have a headache after that. So it may be a hard step. Or the opioid induced hyperalgesia, same things. Give up the opioids, and it's very likely that most of the issues that will solve because it was intoxicating you in a way. So this is an interesting thing. So there's this control thing, but there's also expectancies involved. So let's try to. So we defined it in the reliance on medication, surgery, passive therapies, and immediate solutions that are actually not solutions because they're only covering up for a while and probably not long-term solutions. So if that's the thing, and the reinforcement of the mindset, right? So you all cover that. So why is that quick fix mentality persist? And any
Well,
thoughts?
I think it persists because it does, it's present in some respects, isn't it? And you've sort of given a couple of examples that might be really tangible examples where you see this tight relationship, cause effect. If I do this, if I change this behavior, I will get this instant result. So I think we have evidence of that potentially being the case. It's just that it's not always the case. And certainly what we see is that separation of when things become more persistent, then that relationship, that cause effect, if I do this behavior, then I'm going to see an immediate change in my experience of pain, for instance. That relationship isn't as tight. And so if we are looking to we see a problem with that, in that where in the past, when I've taken action, when I've changed this behavior and it's had this immediate effect, that can be really disheartening. It can be frustrating. It can cause anger. It can cause people to cycle through and see many other different health professionals or different professions in the search for that quick fix, if you want. I think that can be problematic on a number of different levels, and that immediately seeing change is a wonderful thing, isn't it? The success, I've done this, oh yes, it's working, for a buying as well. So if I know that if I change what I'm doing, if I change what I'm eating, if I stop this drug or whatever the examples that we've given have been, and provide evidence that they're successful, I'm more likely to continue with that behavior as well. So when you, Bart, are starting to say to someone, okay, there are a number of lifestyle factors that will help you in the long run, yet it's something that we need to work on for a number of months. Now that you are asking someone a really challenging question there, aren't you? Can you buy in? Are you content to run with this for a few months together?
So I would no, I get that, and it is what's happening in the clinic on a day-to-day basis when you're focusing on long term, and that it often happens when people think, can you just do this, because it's sort of relieving so much. And I think it's a nice balance where you sort of exploring where you actually keep people on the long-term track, but also allow them to have some active, and let's say they can control stuff. Like like self massage or stretching, doing yoga, breathing exercises, which are sort of quick fixes as well, right?
Mm.
But they are controlled, and as long as people know it works on the short term, but it helps you to go through that, let's say, this flare up. I think there's great value in that. But this is my point what I feel like, all right, great. We should do that. We need to give people that, we need to buy in. But how do you prevent that people not, they take the buy-in very seriously and then going to, well, the next time, can you do it again? Or could I take this medication for longer? Because, for example, the opioid crisis has sort of begun with that issue, where especially the oxycodone was doing so great. It was such a relief that it helped people back to their lives on the short term. But then they found out they can't, or they couldn't go without it.
Mm.
So this is what maybe happens in manual therapy. It happens in other types of strategies and therapies, that it's probably not as, say, more, there's not a lot of mortality in manual therapy, I guess, but it's interesting how you're trying to deliver a active role of the patient, but by doing like a 5 minute like pain relief intentional treatment, that people remember that 5 minute and not the other 45 you invested in education, in coping styles, in relaxation, because they're not weighing up. It's like, wow, that relaxation, well, sorry, that treatment, that pain relief was so great. I want more of that. So what's your view on that? Mixing these passive and active strategies in terms of, let's say, quick fix versus potential long term results.
Yeah. I mean, that's a really good question. I do see value in having something active to do. So let's say it was self massage or some relaxation or meditation. These are things that I would do myself as well. So I regularly meditate. I do breathing exercises on a daily basis, but I see them as something that are summative. So it builds and builds and builds. So over a period of time, having practiced them regularly, I have not a immediate effect. I'm thinking, oh wow, these are suddenly really helpful. I'm sort of thinking of them. The way I sort of picture it, and as I talk to people about it, is to begin with, it's like your house is on fire, and doing some relaxation is like getting a small bucket of water and pouring it on. It's probably not going to do an awful lot, but if we get enough of those buckets over a long period of time, and we're constantly putting that water out, then we at least over a period of time, as it sort of burns itself out, and difficult times and stress and stressors, etc. I mean, there's other ways that we would be working with them, but as they in essence fizzle out and settle down a little bit, we still need to put some water on it to stop them from catching up again, and that's a part of how I would see what I do for myself, and also what I'm hoping to do for other people is have a sort of have a toolbox of healthy behaviors that you regularly engage in and that you build over a period of time. So that would look very different for different people.
Exactly.
Some of which might have this felt experience of being, quite helpful and settling and calming and relieving often in quite a temporary way, but doing it enough gives you the evidence of that success, that doing some breathing exercises, I can feel it just settle me down, and I know that I can dip into that regularly, and I know that I over a period of time have some more control over the felt experiences in my body.
Yeah. So this also, I just want to highlight a certain point, because I think this type of giving someone a rub, having like a touch therapy kind of approach, which is delivered by the therapist and being expected or experienced by the patient as, all right, that's the relief, right? Which I find hard. And so my question, and the thing that I've been going through in my head all the time, what is the harm of doing this instead of the benefit on the short term? I feel like there is a group of people in my caseload that are far more, let's say, I would say fragile. If I want to empower them in self-management or empower them, you can do it yourself. I feel like there's sometimes a risk of putting people back, and instead of empowering them, telling, well, I will do it. And then they will be relieved because they seem to be more at risk of taking that on in a way that is not meant, right? So I didn't meant to take away their self-efficacy. I want to empower it, but by doing it, by doing this acupuncture, dry needling, massage, traction, mobilization, manips, anything from a, let's say, therapeutical perspective, or even giving people like a short-term pain relief medication from a, let's say, doctor's perspective, I would feel like it's sometimes, what's the harm? And how, any thoughts on that? Because I feel strongly that it's sometimes we're balancing that out, and sometimes it feels like you can start over again because people, like, they're not in the, you're not empowering them by doing that. So any experience there where you deliberately not taking that, let's say, passive treatment to this patient, even if you're not doing it because you see there's a risk? Do you feel like that's a thing?
Yeah, it's a really interesting observation, isn't it? Because I don't believe in withholding something. You know, let's say someone comes to me and one of my skills is to offer massage, and they say, would it be possible for you to give me a massage? And you do, and it feels great, and they want it again. I mean, what we then have is sort of ethical and moral dilemmas, don't we? In perhaps the financial consequences of doing that, or the reliance on coming to see you, or so yes, there are problems there. But ultimately, if there is little harm within that treatment and that person gains from it, I mean, that's great. Although on its own, not enough. So then being able to educate someone around that, of understanding the sort of temporal nature of that experience, I think is important. But let's say someone had, you know, sufficient money, and they were generally well, and they had a number of things that they do in their life that keep them in a great place, you know, both in terms of their relationships and their finances and their general health and their well-being. What's the harm of someone going to get a massage? I would say zero harm. I mean, great that they're empowered enough to say, I'm going to do this because it's something that I gain from. It makes me feel good. And I'm sure you've had this. I certainly had this as well. I typically don't do it enough, actually. I would love to have that more often in my life.
Yeah. So just remember that a patient of mine, so reflecting on this, which is, she sent me an email. This person, she was in agony. She was like freaking out on a flare up. And to be totally frank, I forgot to answer that email. I basically responded back, I'm not here on Friday. So I said, I think you should know, if you're feeling really in trouble, go to the GP, but I'll be back on Monday and I'll respond to your questions, because she had a whole list of questions. And knowing that she was very, let's say, hyper vigilant, there was a lot of anxiety around this. And then I didn't respond on the Monday, and I didn't respond on the Tuesday, the Wednesday. So that was a bit of a, let's say, my bad. But then she turned up at the appointment, and she thought I did it deliberately because we talked about self-management. I said, "Oh, I think you just by not answering, you're actually saying to me you can do it yourself." And actually, I did myself because otherwise, I said, I'm pretty sure if you responded or called me, I would probably ask for an appointment on the shorter term. But we didn't. It was 2 weeks later. So coincidentally, it made me thinking of probably it's maybe I should be more. I should check my email more regularly. Although I could have not should have not missed it. But on the other end, it also allowed her to figure out herself. And I think that's something when we move away, and that's my if we trust this person, I'm saying I trust you, you can do it yourself, and then being available 24/7, that's not trust. That's not telling you can call me anytime.
Yeah.
Because that's probably some say, well, you're probably gonna be in trouble, so better call me, right? So maybe from a financial point of view would say getting people in. So but I wouldn't I'm not in that position or need for doing that. But I would say, well, you probably can do it yourself, and we're going to make let's say, an appointment on the longer term. But it's interesting how you sort of trying to avoid the idea of that the person can't do it themselves. They actually they are actually sort of dependent on your advice even or your go. So just getting into so this is a bit about the consequences. If we just stick with the quick fix, we see obviously, and the research is also backing up here. So recurring and worsening pain, dependency on medication, passive treatments that are not or even working worse and worse. So they're not doing what they did, right? The first treatment was great. The second one, slightly less. And like number 10 was not even getting any response to the treatment. Frustration when short-term solutions fail, and to provide lasting relief. So all these things, that this whole cascade of stairway to whatever, but not to recovery for sure. So that's a consequence, right? If we facilitate people and not facilitate them in the other way around. So if we need to shift the mindset, and I'm putting you a bit on the spot here, but how would you go about what is it about mindset change and what it takes you to get this person from a more passive to a more active approach? You don't have to get the full answer because I think there are many things here. But what is the things that comes to your mind?
Yeah, well, the first thing that comes to my mind is that won't happen immediately. You know, the idea of that quick fix comes in here, doesn't it? It's something that fostering a relationship, building trust, they are key parts of that process. If someone doesn't feel safe with you, why would they bother going along with some of your recommendations or some of your joint decisions that you've created around that health? So they're the first things that come to my mind, and that can take some time. You know, depending on how long you have with someone, you don't always hit it off immediately. So it can take a bit of time, and having something active to do in the interim as you're building up the relationship is important. And then there's a few different thoughts that immediately come to mind. Is that yes, I might be thinking of the active strategies of empowering someone, of building knowledge and understanding and making sense and understanding the multiple influences on that person's current experience. But sometimes you have to go and sit with their understanding, and in fact, it's more important that you go to them and you do your best to understand why it is that they think currently the way that they're thinking, instead of you going, everything you've always believed about pain is completely wrong, come over to me. I don't think that that's helpful. So yeah, that might require a bit of time. And to be honest, sometimes people aren't as you do move towards them, they might still be going through that cycle of, well, you're not quite the right one because you haven't fixed me straight away. So can we do less or little harm in our interactions, knowing that I might be number 6 in line of 10 people that they see? So I think that's another thing that goes in my mind, is I might not be the last port of call for this person. And then there are certain things that I'm really keen in pointing out, and I have different ways of communicating, keeping in touch with people. It might be email, it might be WhatsApp, where once we have some idea of what they're engaging in, I want to support them in that process. So it might be that they've sent me a picture of going for a walk in the countryside, and that's something that they were working towards. So I'm keen to then support them and celebrate the successes when they happen as well. And I think that that's a powerful thing as well, to know that someone is supporting, but to know that someone's sort of sitting on your shoulders. Like people often say, it's like I've got you sitting on my shoulder, Tim. And I'm thinking, what would Tim think in this situation? Which I think is an okay thing. I believe that's a good thing. Without the reliance of needing to constantly look for, reaching out for and communicating with me. And I do make this quite clear, is if we communicate with each other, it may be a few days before I get back in touch. And I'm not deliberately doing that, but, I want to be able to be in the right place myself in order to be able to read your message or answer to your message. So I'm not doing this at 9 o'clock in the evening as I'm sort of starting to wind down and think about bed. I'm going to engage in it at a time that's right for me as well. So a part of that mindset of engaging in a long-term process is, for me, is seeing our working relationship and how we work together, and my role as guide or facilitator or support or whatever that person sort of sees. But that's how I see myself in the longer term. I don't know if I answered your question, but those were the things that were going in my mind as I was talking.
It's the thing that where we probably have to build our skill set in feeling confident in taking this coaching role, but also using like hands-on techniques if that's appropriate, breaking that cycle. It also comes to my mind like motivational interviewing type of techniques could be very helpful. And sometimes being very strong, well, this is not working because we know it's not working. This type of therapies are proven to be not successful on the long term. So it's not a surprise. People might be surprised because nobody ever told them, or they never took it that way. And I think these strategies, and I'm just signposting to, let's say, clinical confidence series and interviews you've done with expert clinicians. They all, you can see them, why they are good. You can see exactly their communicating style. They know how to bring these strategies in and understanding in a way that it suits the patient's needs, but also sometimes confronting them and being confident in doing it in a very, let's say, protocolized way sometimes, and sometimes just by gut feeling, knowing where you wanted to go. So breaking that cycle by educating yourself or a skill set, building in communication styles is probably a key thing. I guess that's something you can find in our programs, and you don't need to learn from one person. And we've got many. So, any suggestions, Tim, who's been in your mind, comes to your mind, has been describing or facilitating these communication styles which fit in the idea of the mindset change?
Yeah, put me on the spot there.
I know.
I can think of a number of people. I mean, you mentioned the coaching series, the clinical coaching series, and I've been really fortunate. I find it. I actually, it's a privilege to me that I get to talk to really expert clinicians and hear how they do it. And every time I sit with them, I was just recording a session a few days ago with Alison Sim, and I just love the way that she approaches exactly what we're talking about here. You know, engaging in a longer process with someone as well and supporting them through that. So, she had we were talking about pacing and graded exposure relating to pain and pain management, and she has some wonderful ways of describing that and engaging people in that process. So, yeah, I mean, immediately she comes to mind. I've had some great conversation with Bronnie Thompson, Mike Stewart, Bernard Taxa, Laura Rathbone, Morton Ho. I mean, yeah, lots and lots of people. So I wouldn't want to pick out one, but most recent, Alison, and she had a really. So sometimes it's helpful to have some stories, isn't it? And I mean, analogies, stories, metaphors, etc. But she had this beautiful story that helped to engage people in understanding why pacing was helpful and how to engage in it. So instead of saying you're doing it wrong, she had a story about imagine this person who is like this, and so if you come on down, you hear about the lawnmower man, which I loved listening to. So yeah.
Exactly. Yeah. Yeah. Well, that's sort of nice summarizing it. And so, just what we've been talking about, the importance of the understanding of quick fix, where they fit and probably not fit, where they do have not lasting effects in most people with chronic pain. But there's definitely a place for a quick fix, and we also have to admit that we prefer quick fixes if possible, if they work. But we also have to be fair and square there, where it's rarely that we have quick fixes for low back pain, for example. We know it's a mentality that persists, is being driven by many factors, and without going into details, that's something we can sort of, you need skill set. You need a skill set to build that. In storytelling, you said, like making it, like using strategies that are learned or being explored by physio experts all over the world. And we've got a whole lovely, nice bunch of people that are actually doing that with us and sharing their experiences and knowledges, and to build your skill set. That's great, right? So, any closing thoughts, Tim?
Yeah, I think you've done a nice job of summarising it, but I think don't lose heart. Connect with the people that you're with, and the one thing, sort of, I guess, the feedback of working over well over 20 years now, 25 years, is that when you do form a relationship with someone and there is change, it can be one of the most fulfilling experiences as well, of being a part of someone's journey. And I feel really, really privileged that I've been a part of the journey for people in their recovery process. It can be just the most wonderful thing to see. So yeah, hard work, but well worth it.
That's the greatest advice. Amazing. So, thank you for listening in this episode. There will be more upcoming for sure, and have a look. I'll leave it to Tim. Any advice for our listeners, Tim?
Well, if you like this, share it, tell people about it. Come on over to lepub.scientifique.com and you will see loads more. We're building a library of clinical guides to help people understand specific conditions, but also how we might work with someone. So things like living well with pain, functional neurological disorder. So there's a whole bunch there for people to get involved in. And Bart, you've already done a great job of giving us an idea of who we're working with from a clinical coaching perspective. The next person, the science session that we're running, is with Anina Schmidt, who's going to be discussing peripheral neuropathies and decoding the complexity of peripheral neuropathies, peripheral entrapment neuropathies. So yeah, lots to come, lots of great stuff coming up.
Great, can't wait. Thank you for listening. Have a great day, and see you next episode. Thank you.